I'm Dr. Stephen Falowski. I'm a functional neurosurgeon in Pennsylvania. I specialize in the treatment of chronic pain. So dorsal root ganglion stimulation is a very specialized form of what we call neuromodulation. Essentially, it is a treatment that's used for the focal pain conditions. Most commonly in the US, it's approved for what we call CRPS, which essentially is a nerve damage to a single nerve within the body of the lower limbs. Dorsal root ganglion stimulation is a way of actually stimulating a single nerve to actually treat that focal pain condition and block the transmission of pain or modulate the way that you're feeling that painful condition. The US pivotal trial, known as the ACCURATE study, directly compared DRG stimulation to traditional spinal cord stimulation for the treatment of CRPS of the lower limbs. The results that we saw were dramatically different in the comparison of those two, and the success rates were significantly higher. When I first met Cam, she was actually suffering from groin pain for over 15 years, which came on after a hernia repair, in which there was injury to a single nerve causing groin pain, as well as pain that spread into the front portion of the leg. Historically, that's very hard to cover that area because it requires generation of a signal on a very select nerve root. DRG stimulation gave us the ability to focus that signal into a very small area and cover that painful area that our patient was suffering from.
My journey with chronic pain started about 15 years ago. I have tried numerous different methods of trying to control the pain, as well as 13 different surgical procedures, narcotics, a lot of side effects with some of them. Some of them helped dull it, but nothing really controls it. Took pretty much most of my life and activity away from me.
When I introduced DRG stimulation to Cam, there was a small bit of hesitancy in her. As a nurse, she has seen a lot of the treatments that were available in the medical field. She has also gone through numerous treatments for her pain over the 15-year period. But when I told her the success rates that we would expect with this therapy and how great we felt that it was working and rewarding, she was actually very interested in pursuing the therapy. So with DRG stimulation, I've actually seen significant improvements in my patients, especially in functionality as well as in control of their pain.
After having that final implant and getting my DRG therapy, the difference that it's made in my life has been incredible. I know now I can look forward to my future.
Following Cam after the procedure, she has done extremely well with DRG stimulation. You can see a significant change in the way she views life and the way she's actually looking at moving forward now. I find it very rewarding to be able to decrease the pain my patients feel, increase their activities, even the performance of just daily activities, and increase the joy that they have in their life.
These are actual patient stories. The stories are the experience of these individuals only. Although these patients did not experience complications, there can be risks and potential complications associated with the use of medical devices. If you are interested in learning more, please consult your physician. The speakers in this video may be paid by St. Jude Medical, but the content of this presentation represents the beliefs of the speaker and not necessarily the views of St. Jude Medical. U.S. Indications for use. Spinal column stimulation via epidural and intraspinal lead access to the dorsal root ganglion as an aid in the management of moderate to severe chronic intractable pain of the lower limbs in adult patients with complex regional pain syndrome, CRPS, types 1 and 2. Study subjects from the ACCURATE clinical study had failed to achieve adequate pain relief from at least 2 prior pharmacologic treatments from at least 2 different drug classes and continued their pharmacologic therapy during the clinical study. Please note that in 1994, a consensus group of pain medicine experts gathered by the International Association for the Study of Pain, IASP, reviewed diagnostic criteria and agreed to rename reflex sympathetic dystrophy, RSD, and kyphalgia as complex regional pain syndrome, CRPS, types 1 and 2, respectively. CE mark. The spinal modulation neurostimulator system is indicated for the management of chronic intractable pain. Australia. The spinal modulation implantable neurostimulation system is indicated for spinal cord stimulation, SCS, for the management of chronic intractable pain of the trunk and/or limbs. U.S. Patients who are unable to operate the system, who are poor surgical risks, or who have failed to receive effective pain relief during trial stimulation. See EMARC and Australia. Patients who have an active implantable medical device including, but not limited to, cardiac pacemakers and cardiac defibrillators are unable to operate the system and are poor surgical risks. Warnings, precautions. Diathermy therapy, implanted cardiac systems or other active implantable devices, magnetic resonance imaging, MRI, computed tomography, CT, electrosurgery devices, ultrasonic scanning equipment, therapeutic radiation, explosive or flammable gases, theft detectors and metal screening devices, lead movement, operation of machinery and equipment, pediatric use, pregnancy, and case damage. Adverse events. Painful stimulation, loss of pain relief, surgical risks, for example, paralysis. Implant manual must be reviewed for detailed disclosure. Refer to the user's manual for detailed indications, contraindications, warnings, precautions, and potential adverse events. Caution: Federal law, USA, restricts this device to sale, distribution, and use by or on the order of a physician.